there is a strong link between health problems and weight problems. The one affects the other. To determine our weight, we weigh ourselves on a scale. This reading gives you an indication of your total body weight, which has two components: lean weight and fat weight. Lean weight is everything else in your body but fat, and includes the muscles and water. It produces work and burns food, and therefore increases your metabolism. Fat weight includes the fat stored in fat cells and in the organs of the body. For the average healthy person, lean weight is about 75 to 80% of the total body weight, and a vital fat weight between 15 and 25%. Females normally have slightly higher fat weight proportions than men. Overweight people have higher fat percentages. When this excess fat is stored around the waistline, it acts as baggage for the body and has a dramatic correlation with illness and disease. This is referred to as abdominal fat, or the so-called apple-shaped figure, and can be determined by measuring your waistline at the level of your navel. A woman's waistline should be less than 80 centimeters, with an absolute maximum of 88. A man's waistline should be below 94, with a maximum of 102 centimeters. The reading on your bathroom scale does not always tell you what is happening in your body, and therefore does not give you the full story. What is your waistline measurement? Is your stomach bursting through your shirt? Are you developing love handles in your upper body? If your answer is yes to any of these questions, you are at risk of ill health. An increased waistline or excess fat does, however, not suddenly arrive. It usually is a consequence of your weight history and daily blood sugar imbalances. This in turn can be caused by modern-day living with subsequent nagging symptoms that deprive you of quality of life. There are, therefore, always changes in the body before the increased fat becomes apparent. Let's first look at your weight history by answering the following questions. Do you know your own birth weight? Was it less than 2.5? Were you overweight as a baby or a young child? Did you rapidly gain weight before the age of 7? Did this continue as a teenager? If you are a mother, can you remember your child's birth weight? Was it more than 4 kilograms or 9 pounds? Did you have diabetes or preeclampsia when you were pregnant? Of late, do you find it difficult to lose weight? Are you a professional dieter? In other words, have you been on every possible diet that has made the headlines? Have you intentionally lost up to 5 kilograms at least 3 times in your life? If you answer yes to any of these questions, you can already identify at least one clue as to where your dilemma of now being excessively fat started. If you answered no to all these questions, you will find your clues in the following section. Your challenge for optimum health is to maintain your blood sugar level in a very narrow range. When your blood sugar level is in the green zone, it helps the body to focus on all normal and essential processes that should take place during the day and throughout the night to keep it healthy. As soon as the blood sugar starts to fluctuate in the red zone, either high or low, the body starts to stress, and this can influence your quality of life dramatically. Modern-day living offers the perfect formula for causing blood sugar imbalances. Consider the following. Do you skip breakfast or any other meals because of a time constraint? Neglect your regular exercise routine? Or is there a total lack of any kind of exercise due to busy work schedules? Do you have chronic unattended life stresses such as trauma, divorce, retrenchment, or abuse of children? Do you have a regular quick-fix eating pattern such as takeaways and restaurant meals? Have you had an increased intake of sugary foods like sweet soft drinks or sport drinks, sweets, muffins, cakes, and fatty meals? Have frequent coffees and snack meals? Use alcohol excessively? Do you smoke or live close to someone that smokes? A poor diet is a key factor in the cause and maintenance of fluctuating blood sugar levels and is an important clue in the diagnosis of your problem. Fluctuating blood sugar levels can directly or indirectly affect your quality of life in one or more of the following ways. An intense lack of energy throughout the day, excessive daytime sleeping, a sudden drop in energy levels during any time of the day or after a meal, waking up tired after a good 8 hours of sleep. Even worse, falling asleep while you are driving your car, a slight throbbing headache, or waking up with a headache, anxiety attacks and blackouts, an urgent need to eat something really sweet or savory right now, addicted to cola drinks, coffee, more than 4 cups a day, chocolates, jelly sweets, and cakes or crisps, and salty biscuits, to name but a few. Difficulty falling asleep. Toss and turn between 2 and 3 in the morning. Vivid dreams or nightmares. Talking, walking, or snoring in your sleep. Midnight snacking. If you positively recognize a number of these nagging symptoms, your fluctuating blood sugar levels are already affecting your quality of life. Let's summarize what we've learned up till now. Upper body obesity is indicated when your waistline is more than a maximum of 88 if you're a woman, and more than a maximum of 102 if you're a man. This is often referred to as the apple-shaped figure. It is caused by your history of weight problems and a modern lifestyle. Modern-day living with quick-fix, highly processed meals and high-energy snacks, as well as a sedentary lifestyle, contribute to fluctuating blood sugar levels. This, in turn, is associated with the nagging symptoms of yo-yo energy levels, unwanted headaches, poor quality of sleep, and mood swings. If this scenario has been going on for some time now, your body is most probably already trapped in a vicious cycle of an increased generation of free radicals, followed by oxidative stress and cell damage, inflammation, as well as insulin resistance. This destructive metabolic cycle increases your risk of ill health dramatically.